Uh, this was the part that was to be taken by Jayashri Das. She is a consultant clinical psychologist. She practices along with me in my clinic. So uh, basically, she is more skilled in delivering this part because she regularly deals with patients um, who has stress or depression or anxiety from a psychological perspective. So, but because as I have already told, because of her health issues, she could not be presenting it. So, in a brief, I'll be telling you how to keep your emotional well-being at a balanced level, because you need certain skills to maintain that positive outlook in life, that positive emotion in your life. So the first and the foremost factor is obviously, which we believe again as mental health professionals, are the soft skills. Many of you might be knowing what is soft skills, but soft skills depends on our EQ again. As I have already told in my presentation, more than intelligence, more than the hard skills which comes with the emotion, with the IQ. EQ is what we stress upon. EQ will give rise to soft skills. Soft skills is just how we interact with others more effectively and harmoniously with others. How effectively we handle our day-to-day activities, be it in our family life, be it in our work area, how effectively we manage time. All this depends upon the soft skills. Okay, if we can see this, these are the critical differences of what hard skills and soft skills. Hard skills is obviously your degrees, your qualifications, your certificates, how how well educated you are. But soft skills depends on all these emotional factors, the leadership qualities, your time management, your communication skills, your handling of any situation, your handling of any problem, your handling of your team, basically is what soft skills that is all about. And it's very well said that hard skills, your degrees, your qualifications, your certificates will definitely get you a job, but to keep that job and to work proficiently, you need to inculcate that soft skills. So if you have the soft skills, you can definitely face any adversities, face any problems, and then again you will have a good set of positive mental health. uh, Another factor is obviously what resilience is. Resilience was presented yesterday, I guess, by one of the speakers. So I'll not stress upon that factor, but this is one important factor again. It's the ability to bounce back in life through serious life challenges. So that resiliency we need to build upon. It might yesterday you might have attended it, and the presenter must have told you how to develop resiliency. But again, resiliency is also a factor of EQ, which keeps our emotional well-being at bay. So as professionals, we strive that we give very stress upon the factor that it should be started and it should be taught right from the school age, right from the kindergarten level. We should teach those students. And there has been rising stressors that students goes through nowadays because of the academic pressure, because of the peer pressure. As after clearing college, you have job pressure, you have family pressure. So resiliency should be in everybody's characteristics nowadays, and one should try to develop resiliency. I won't go into the details of resiliency because it was presented yesterday. Okay, just to give the characteristics of what resilient person is. He has the capacity and motivation to go forward. He has the power to stay centered to whatever objectives and goals are in his life. And he has a positive role model who he looks upon, who he sees upon. He has the capacity to take the responsibility. Whatever situation is he is in, he has the tenacity to go on, to cling on to that situation and accomplish his goal. Most importantly, two factors which is very much needed in a resilient person is the gift of laughter, which is to stay happy, stay content, and also believe in a higher power. Because nowadays, in the definition of health, a fourth dimension is added, which is apart from the physical, mental, and social well-being, the spiritual well-being is very much stressed upon. Spiritual well-being comes from all the yoga, meditation, which you will be having sessions on. uh, then there will be sets of how you handle your problem, how you solve your problem, right? Because as I have already told, there will be challenges in life, there will be problems in life, there will be stressors in life. With our coping strategies, with our personality factors, we need to identify those stressors, we need to create and manage those problems by ourselves. First we identify the stressors obviously, and then we need to create certain strategies. We need to build plan B and plan A if plan C if plan A fails. So that is how you should try and solve the problems. This is how we tell patients that patients come with various problems, there will be some stressors in life. We ask the patient to identify those stressors, and we give them their own opinion that yes, you are having the problem in this areas, list down 5 things that you can cope with these stressors. Then we give the most holistic and most logical explanation of which way he can control the problem. Okay. First is we always analyze the program, then we find out alternative ways to tackle the situation or a person you are having. Then we find out the best solution and implement a plan. This is the best model which you can follow. This is again given by WHO, and we give this program and implement this on patients basically. And then to come out of any stressor, on to come out of any problems in life, and to maintain a good set of emotional well-being, we need to have a growth mindset, right? People who has fixed mindsets can never develop and come out with his problems. A fixed mindset person will always avoid the challenges, he will give up easily, and he will ignore, most importantly, the negative feedbacks. That is why a person who has growth mindset always will try to learn from criticisms, because your critics are your best teachers, right? So as individuals we need to have a growth mindset so that we can face our challenges, we can strategize our problem behavior, our problem situation, we can find out solutions, and we can learn from our past experiences. Okay, that is how a growth mindset develops, and that is how a growth mindset works basically, to find ourselves come out of any struggling situation or any stressors in life. Okay. Most importantly, we should always try to have a positive thinking behavior. Okay, these there are certain tips which we can always follow. We should always view setbacks as temporary. There will be failures. No, no, no. Do not take back the thing that you will always succeed in life or will be always successful in one area. Okay, there will be setbacks in life, but as individuals we should always view those setbacks as temporary. Okay, most of us dismiss our positive events, whatever happens in our day, with a minor negative event, with whatever bad happened to the day, we always stress on the negative thing that happens to our day, but and we dismiss the positive events which has occurred throughout our day. Okay, we should not do that. Okay, and then again we tend to blame ourselves of the things which are beyond our control. So by practicing all this, by negating all these problems, you need to promote positive thinking. Okay, as I have already told, we should always plan for our failures nowadays. We should hope for the best, but failures might be coming. So we should be flexible. We should be more. We should keep our options open. We should always have plan B and plan C. And then again, we should accept change as a part of our life. That will help you to come out of that fixed mindset area and go beyond the growth mindset area, and that will help you to come out of your most negative events in your life. Again, please do not accept perfections from others, or that others should always help you, because expectations hurt, right? If you expect something and that does not happen, that expectation is not being fulfilled by a certain individual, or that situation did not come out of your expectation, we always tend to go sad and we become low that yes, I expected this, it does not happen. But rather we should accept everything. Again, that acceptation comes with we being more flexible and we having more options and we accepting the change. Okay, and then that is how we should go forward. Most importantly, we should avoid unnecessary competitions in whatever area we are. If we compete, if we have unnecessary competitions, that will put added pressure on us, that will put added stressor on our life. Be content and be happy with whatever you are doing. Rather compete with yourself. And that is how we should recognize and accept our own personal limits. We should recognize that this is our limitation. Me as an individual can do only things up to this limit, and I cannot stretch or go beyond this point. So recognition and accepting your own limits and avoiding unnecessary competition helps a lot. Again, to have a growth mindset, we should go easy with criticisms. If you are being criticized by someone, take those criticisms in a positive way. Although you might not like it on the face value, but take it in a positive way. Learn from that criticism. That will help you to learn from your past experiences, and that will help you to solve your problems in the future events or in the future negative areas. Right? Again, we should always have an tendency to apologize and rise above our egos and attitudes, which I believe and which we believe as mental health professionals. Because the more egoistic you are, the more attitudinal problem you have, that will take down to another low, and that will lead to you having again unnecessary competition, so that the cycle goes on actually. And finally, obviously, we should always take time off from our day-to-day work, from our day-to-day extracurricular work. We should do whatever hobbies we have, whatever recreational facilities we have. We should always carry on with the activities. That helps a lot. Okay, I've seen those slide. Whatever taking time off means, self-care, paying attention to whatever you need. Play an instrument, read a book. If you have hobbies in gardening, do that. Cooking. If you like cooking, cook something. Spend time with your family. Watch TV. Whatever you like, that helps a lot basically. And time management, obviously, you have your own work schedule. You have your own areas of what to work, what not to work. So I'll keep that to yourself, but always we should have a highly structured routine. But yes, again, to have a growth mindset, you should not stick with the structure. Always be flexible, always be easily adaptable to change, because anything might happen anytime in our life. So we should have a highly structured structured routine, but we must be ready to change that. As I have already told, know your limitations. Do not go beyond the point which you cannot do. So do not overburden yourself. Okay. So that will help you a lot. And always maintain a hopeful attitude, hopeful hopeful outlook that good things will come. And regrets are there, guilt is a part of our life, because uh, the more you focus on the past negative experiences, it will make you depressed, and the more you think about the future, it will make you anxious. So always present on the focus, present on the correct attitude to go beyond life. Okay, so that will help you a lot to come out of the stressors. Besides this, you will be having classes on meditation and yoga. People are expertise in that area. And yes, meditation, yoga, good nutrition, exercise do help a lot to keep a positive mental outlook, and emotional well-being is very much a part of this regime. Yoga, nutrition, meditation do help a lot. And as a doctor, as a professional, when we see patients, when patients come to us with features of depression or anxiety or stress, there is always a question that the patients ask me that, sir, will the medications work, or will I need medications? Can I do only yoga and meditation? Can I do only a good exercise regime so that I can improve? See, all these things which I have already told you, that maintaining a good outlook, focusing on the present, accepting changes in life, maintaining good sleep hygiene, exercise, meditation, yoga, taking time off, getting involved in recreation activities, relaxing, taking time with your family. These are all preventive strategies. These are all preventive ways. These are all healthy lifestyle ways that will help you to keep your emotional well-being at ease, and that will keep you in a positive state of mental health. But as I have already told, it is easier said than done. Many of the persons cannot keep up with the stressors. They pile up, and then when threshold is gone, people suffer from anxiety and depression. So that is the time you need to seek professional help. That is the time your yoga and your meditation and your good nutrition won't help you. There will be times when people suffering from all these problems might need some medications, which we are there for. And medications are 100% safe, they are scientifically proven, and you need to take medications, or an individual if suffering from some of these features of depression and anxiety come out beautifully and they improve life anything with medications. If someone is having to have diagnosed to have depression or anxiety, cannot improve with mere meditation or exercise or good hygiene or yoga. Okay, so for example, I always give the example that if you are cooking a dish, you have to give salt. Okay, salt is the primary thing, or oil is the primary thing to cook a dish. But besides that, that is why if you are suffering from depression, your medicines are like the salt and the oil. But apart from that, whatever you give extra masala or extra sauce, that will give added taste. Apart from medication, medicines which I'll give, apart from medicines which your psychiatrist will give, if you do yoga meditation, that will definitely help. But only yoga meditation exercise won't help you to keep, that will help you in a preventive way. But if an individual who is already suffering, only yoga meditation is won't help. But again, I am stressing this point, these are healthy lifestyle habits that will keep your emotional well-being and positive mental health at the upper level, and will help you to prevent most of the stressors in life. And finally, again, please seek help. Please communicate with your colleagues, with your friends, with your family members, and obviously, social support system are there. And seeking help is the most important way which one can come out with these common mental disorders. And seeking help is not a sign of weakness. In fact, it will help you to come out in a more positive way. Thank you. Uh, if the uh, moderators are present, I can take the questions now.
Yes, of course. The participants, if anybody wants to interact and ask questions, you can.
There are some questions. I think this is Aradhana.
Yes,
Hello.
yes,
Yeah,
yes.
if I see some of the questions in the chat box, I can take them one by one.
Should I read them out?
No, I have seen in the chat box some of the questions.
Hello.
Yeah, yeah. Hello. Am I visible?
Yeah, yes, sir. Good evening, sir.
Yeah.
So it's, I want to see the third slide you showed. Before that, one slide was there. I want to see that, sir.
I did not get your question. Can you type it in the
Sir,
chat
in
box?
the second, am I audible?
Yeah, but you're not clearly
So
audible.
in your second session, the
Yeah.
third slide you showed, sir, I want to see that, sir, please.
Second session,
Uh,
third slide, she's asking.
this is the slide you want to see. Hello. Hello.
Anita, madam, are you there?
Oh, this is the slide. This will be the third slide, I guess. One of these two slides.
I think madam is out of connection.
Okay, then I can take one of the questions being asked by Navamita Dev ma'am, I guess.
Yes.
If you can touch upon the clinical methods of treatment and detection of stress. See, uh, if I go into the medical terms, stress is not an illness in our book. Okay, stress leads to anxiety and depression, which are considered as mental illness. Okay, stress leads to, again I'm clarifying the points. Stress leads to depression and anxiety, which are diagnosable medical illness. But obviously, there are various methods which we can detect stress, or which we can find out the severity of depression or anxiety someone is going through, and if depending upon that severity, we plan our treatment strategies. If someone is going through mild stress or mild depression or mild anxiety, we do not give him any medications. Okay, we simply refer them to a registered clinical psychologist. And I just like to bring one point to notice is that a clinical psychologist means those who has done an MPhil in clinical and social psychology. They are only like we have license from MCI, Medical Council of India, to write medicines. A clinical psychologist who has done MPhil in clinical psychology has the license from Rehabilitation Council or ICI to see and treat patients. Only just clearing post graduation in psychology do not give you the right to see patients. So you should always go to a registered clinical psychologist who can who can deal with these cases. Okay, so depending upon the severity level, we refer them to clinical psychologists who has who have their own regime of treating mild depression, mild stress or mild anxiety with their own behavioral therapies or cognitive behavioral therapies. I won't be going into that details, but if we find on assessment or interview that if the person who has come to us has higher degrees of depression, or if the severity of depression or anxiety or stress is very severe, he has suicidal thoughts, he has crying spells, he has become very aggressive, he has become irritable, then definitely we give him medicines to bring down the level of depression and bring down the level of anxiety. And then once the with medications those depressive levels, those anxiety levels, those panic levels have come down, then there is a combination of both behavioral therapy and psychotherapy from a clinical psychologist, and then our medication part we slowly stop. So that is how the treatment and detection of stress, depression, and anxiety goes on. Hello.
Hello.
Yeah.
Yeah, can I ask a question? Hello.
Hello.
Sir, am I
Yeah.
audible to you?
Yeah. Audible. Clearly audible.
Yes. Stress is due to the stressors. That is how we analyze it. The stressors are, there are certain stressors which are, it could be object, it could be a situation, event, or a people. In case of when people are the stressors for a stress generation, many things are not in your control. Many times you
Correct.
can change yourself, but sometimes when people who are involved act as a stressor,
Hmm.
you might have come across people such questions. How you deal with them? How we deal with
Yeah.
such situation?
Yeah. See, when you might have correctly told that stressors are due to various reasons, right? It might be a financial stressor for you. It might be a job-related stressor for you. At times, there are persons who are stressors for you, like someone, a very close colleague of you who might create a stressor for you, or your boss might be acting as a stressor for you. Okay, then there are different ways of how you tackle those situations with him. At times you need to curb down your own instincts when you interact with that person. Okay, when that person, which I have already told in my last presentation, when some that person will create a stressor by criticizing you, just let go of those criticism. And if he gives a good criticism, you obviously take that in your good stride. But if he creates criticisms upon criticisms unnecessarily, at times you have to curb your own instinct of how you behave yourself with that person, of how you avoid those situations, because that is also a problem solving situation. You analyze the situation on what situation that the person will create a stressor for you, on what areas that person is a stressor for you. You try to avoid that situation. Obviously we tell patients that if you are having problem with that, please don't go to, or don't interact with that person at all. Or if you need to interact in the things which is of utmost importance. Unnecessary interaction which creates unnecessary stresses for you, you should avoid. Correct.
Yeah, but in certain situation it is not avoidable. if the person is your boss and constantly
Yeah, that's what most of the patients, most of our patients do generally have problems with their bosses only. But that again, since you're working with that in that area, in that situation, again your personality comes into the forefront. That's what I told. Adjustment is one of the issues. Okay, you should try to adapt to the situation and try to adjust. Otherwise, in at many situations we give a second chance, or we give the option of leaving the job, but most of them cannot, right? So
yeah,
there are ways which you can find the solution yourself. Okay, when we speak with you, when the patient comes in front of us, we obviously give them different reasons and different regimes how to follow, what to follow, and then we give them the best option, that in this situation your boss is acting like this, he criticizes you, let go of the criticism, he gives extra stressors on you, he take that as a stride and take that as a positive challenge in your life. Okay, and most importantly, avoid unnecessary communications with him, do the most important communications, and at the best method is just to adjust and cope with the situation.
okay. Thank you very much. Will you be sharing these presentations which you have given? Because many of them are asking for it.
Yeah, that I'll speak with the coordinators once. Okay.
Okay, thank you.
Hello, I have a question.
Yeah.
Hello,
Yeah.
can you hear me?
Yeah. Yeah.
Okay, the question is, suppose if you're irritated about some person who keeps calling you and gives you and you feels very stressed. So is it uncourteous of number one not picking up the phone, or
Hello.
even
Your
keeping
voice
it
is
up?
breaking, ma'am. Hello.
Can you hear me? Can you hear me now?
Yeah. Yeah. If someone is
Okay.
calling you, your voice broke in between.
Okay, should I repeat? Okay.
Yeah.
Well, suppose there is a person who by talking to them, it is very stressful. Okay.
Okay.
Now, is it uncourteous to not picking up their phone, number one, or if you pick up the phone, you hang the phone immediately? Is it uncourteous or is it the right way of avoid stress?
That depends with whom you are speaking, ma'am. That depends on what situation he or she calls you and irritates you. That depends on the various factors actually. So, can you give an example basically? Uh, uh,
Suppose it is your friend, okay,
okay.
or it's your relative, okay, and that person keeps repeating the same question over and over again for which you don't have any answer to it. Okay,
Okay.
now
Okay.
this person
Yeah.
keeps
Yeah.
calling
I got
you.
it. Yeah, I got
Okay.
it. That that
Mhm.
that that is that to avoid this situation, to avoid the stresses, obviously it will be in your best rights if you avoid that situation, if that is absolutely unnecessary in your stride, if you think, okay, that does not go against courtesy, or that does not goes against any decorum, right? But if that phone call, or if that irritation, or if that talk will cause irritation which is not necessary on your part, definitely we suggest, we advise people to avoid those situations.
I mean, so not picking our phone or picking up the phone at the middle of the
Obviously,
conversation
see,
is
yeah,
not
no, see,
uncourteous, right?
not obviously you can solve it in a amicable way, right? You can explain it to him that this is the problem I'm having, this problem I face after I speak to you, so it will be best in our in my health that if we can solve these problems later on, or obviously there will be a third person which can help both of you. Okay.
Yeah, but sometimes it so happens that it goes beyond explanation.
Yeah,
Okay,
then beyond explanation, that yeah, beyond explanation, if it creates a havoc in your life, it creates a stressors in your life, then obviously you need to avoid that situation.
so that's what. Just I want to clear
Yeah.
the conscience. I mean,
Yeah.
like whether it is uncourteous or not. Okay,
Yeah.
thank you.
Hello? Hello? Hello?
Yes, Subir sir.
Hello?
Yes, Subir sir, you are
Hello,
audible.
We want the PPT actually. This is a very detailed PPT. So without that, we cannot prepare at the end these assignments and all these things, because everything is not possible to memorize.
yeah, I'll speak with
Because it is
Aradhana
totally
Mishra
a new
regarding.
subject.
Okay.
It is totally a new subject. So it is will be very helpful if you share this. Okay.
Okay, I'll speak with Aradhana once I finish this
Otherwise,
session.
it's not possible to memorize so many things, so many minute details.
Subir ji
Thank
will
you.
take care of that.
Thank you, sir. Okay.
Okay, thank you.
Dashi, one more request is there that at least subscribe at least
Hello.
one book, one simple
Yeah.
book which one can read and at least understand certain things. And the same request is to Madam Anuradha ji that she will also request to all the speakers at least they should suggest one or two books so that one can go through if somebody has certain interest. Thanks.
Dr. Anweshak, any book suggestion you would like to give?
Mm, uh, Basically, will you be conducting any exams after all the presentations? That's why I wanted to know.
There is a very simple exam that we will have at the end. It is mandatory, but we can take care
Okay.
of that. And if you agree to share your PPT with us, you can share. Or if you want to give us some other reading material, it is up
Okay,
to you.
I'll share my PPT. I'll share my PPT. But books, basically, there are many books. I don't think reading a book will be helpful currently. I'll share my PPT, and the teachers seniors can go through the PPT for time being. But there are a list of books I'll send to Aradhana Mishra tomorrow, and maybe Aradhana can share it. Okay.
Yeah, sure. Thank you. Would you like to take up more questions?
Yeah, time is there. If any other question is there.
There is a question, but Tripti Rani Bora ma'am, how to minimize anxiety?
Okay. And just I saw it in the text. Books will be difficult. Basically, I also am in favor with Tripti Rani Bora ma'am. At this point, reading a book will be too much time consuming, and it will be difficult to understand the perspectives which I have given you. Right, because then I'll only be sharing my PPTs. Obviously, I can give a list of books. Then it's up to the participants. Okay. The question by Tripti Rani ma'am uh, is how to decrease anxiety, minimize anxiety. Ma'am, I have already spoken about how to keep a good, healthy lifestyle to decrease and keep your emotions at a certain level in a positive way. Obviously, there are scenarios. There are different scenarios of which causes anxiety, and that will depend upon scenario to scenario or situation to situation. Okay, but there are certain things there are certain things or events which causes sudden panic in someone, sudden irritation in someone. At best, what we suggest to start with, we can always try the deep breathing method. Okay, deep breathing method. What happens when we are very stressed up and when we are very anxious? There are two systems in our body, the autonomic nervous system and the sympathetic nervous system. What happens, that sympathetic nervous system rules our body when we are very anxious or when we are very stressed. That will lead to our heart beating fast. There will be palpitations. We might have urgency to go to the toilet. Then we'll have sudden tremors. We'll sweat a lot. We will have difficulty in breathing. Those anxious moments and those panic moments are taken care of by deep breathing method, which will be obviously be taught, I think, in yoga and meditation classes. So what happens when there is a deep breathing? When you take a deep breath, hold your breath for 10 seconds and let go of your breath, ultimately the sympathetic system comes down and the autonomic system, which relaxes our body, comes into the act. So that is how you can, to start with, you can handle much of your anxious moments or much of your panic moments. And otherwise, if the anxiety and panic is very much, if it is regular, if it is diffuse, you have anxiety and panic or stress in every other situation you have, definitely you need to take help and seek help from a professional. Because at this moment, on some situations, I need to assess what causes your anxious moments, which moments you are struck with excessive stressors. So it has to be handled on an individual level and on a situation to situation person, actually.
So there is another question. Can EEG be a good measure for stress?
What?
Can
EEG.
EEG be a good measure? I mean, how to detect
Where is
stress?
that question?
Navamita Dev.
No, EEG is not a method to find out stress. It is to find out the seizure activities in our brain. So that is absolutely out of this presentation. That is when someone is having epilepsy or someone is having brain tumor, then we go on to do EEG. But EEG cannot detect stress. To find out stress and anxiety level, we have certain questionnaires. We have certain methods of interviewing patients and assessing patients. And again, as I have told, the patient has to come up with their individual variation, what causes them stress, what situation, which person, what experiences. Even a small post traumatic stress can cause anxiety in a person. So different person have different manifestations of and different presentations of stress and anxiety. See, basically any psychiatric illness, we detect and we have certain questionnaires to find out the levels and severity. And by questioning and interviewing the patient or the individual, can we come out with the diagnosis and the severity. But EEG is not a way to find out the stress level.
Fine. Dr. Das, do you believe in
Yeah.
past life?
Excuse me.
Do you believe in past life?
See, past life are there. There are patients which have remembrance of past life experiences. Okay, and those past life experiences do cause a level of post-traumatic stress or do cause a sense of depression in our patients. But although I have just started my career, it's only been 7 years since I have been practicing psychiatry. I have only found one patient like that. And this question I also have asked my dad, who is also a psychiatrist, who have been practicing since the last 36 years. Also in his career, he has only found 2 to 3 patients like this who has past life experiences. And mostly past life experience people have some deep-rooted trauma in them when they remember their past events or past experiences or past life events or past negative experiences in their past life. But again, this research and the school of thought who goes on to do hardcore experiences on past life events are still in the hypothesis level. They are not very scientifically proven, and it's still a debatable area. And I'm not quite experienced in that area still.
Do you utilize regression therapy?
Excuse me.
Do you utilize regression therapy?
Yeah, regression therapy is utilized by my wife. I am not expertise in that because
Okay.
only a trained clinical psychologist does all these therapy parts. I am basically a psychiatrist, so I only deal with medications and I partly with counseling and therapy. But hardcore cognitive behavioral therapy, regression therapy, all dialectical behavioral therapy are being dealt by clinical psychologists.
Thank you, Dr. Das. Thank you very much.
Any more
If there
questions?
are any,
Okay, one more question is there.
yeah.
The NLP, Neuro-Linguistic Programming, is nowadays going to be popular more and more.
Yeah,
People are
correct.
adopting it.
Hello. Yeah, it is
And
Neurolinguistic program.
Neuro-Linguistic Programming, NLP. NLP is a technique.
Yeah. What do you want to know about neurolinguistic programming?
Actually, does it really works First thing, because it is being popular, it means it is working. Second thing,
Yeah.
what are the failures, you can say merits and demerits of this one, this therapy?
See, again, this program is a very newer approach, right? Well,
Yeah.
when we studied Neurolinguistic program is still coming out. Still, again, I'll like to stress upon this area is very new. Okay, and many believe that this is a part of psychotherapy or part of cognitive behavioral therapy. But definitely, it has been helpful in treating much of the phobias and depression, and also some of the many of the patients with depression have vague pain or vague low motivational symptoms. Those are being definitely. There are some reports that patients have improved, but again, solid concrete evidence are still not yet there that NLP is the one that you should use when a person is having depression. It might be a part of the therapy process, but again, there is no robust scientific evidence that one can say or one can advocate NLP in every patient suffering from stress, depression, or anxiety or phobias. Rather, we go back to our old school, which have been proven with cognitive behavioral therapy and dialectical behavioral therapy. We are still waiting for more robust results, basically.
Okay, sir. Thank you.
Hello, sir. Hello. Hello, sir.
Hello,
Ayadaji,
your
speak
voice
very
is
loud.
very,
Hello.
your voice is low, ma'am.
Hello.
Yeah, audible now.
Sir, my question is the PPTs you are sending, it will be on our email ID or how it is? Because every time it happens like this and
No, I don't
I'm
have
not
your
sure.
email IDs. I'll be ready sending
No,
it to the
no.
moderator.
Okay, fine. Fine.
Hello.
Thank you.
Okay. If there are any other questions,
Any more questions from the participant side? I think that was it. What are the symptoms of depression? I think. Would you like to take
I have
that?
already told you, Madhuri ma'am, what are the symptoms of depression in my first presentation. Uh, People might have externalizing behavior, or people might have internalizing behavior. Internalizing behavior, they will have symptoms of talking less, becoming withdrawal, becoming aloof, remaining confined to a room, not speaking with others. He will have no interest in other activities, whatever activities he will do. Okay, they will have abnormal sleep pattern. Okay, they will have crying spells. At times, they will have irritability in trivial issues. There will be sudden anger outbursts. People with severe depression have death wishes, suicidal ideas. So, and there will be a feeling of hopelessness, guilt, worthlessness. When guilt, hopelessness, and worthlessness is very much, then people will have suicidal ideas. And at times, when people have severe depression, they start behaving in a very suspicious way that someone is conspiring against them. That's why they have been going through all these mood symptoms. So there are there is a whole spectrum of symptoms for depression. Young children come to us, students come to us with features of low concentration. There will be many young ladies come to us with features of bodily complaints. There will be headache, there will be a feeling of vomiting, and when we assess and assess, they will ultimately come out with marital problem with their spouses, and they will cry in front of us, and then we diagnose it to have having a depression. So it depends upon person to person, basically.
There is a repeated question actually in the chat box. Someone is asking how to control emotions.
Hello. Yeah, that I have already explained. And then in a, how is some, if someone spends more time in sleeping, is he or she under depression? No, only sleeping is not a sign of depression. Basically, you will have to assess the person. He will have other symptoms which I have already told. Okay, and sleep time also differs from person to person. Basically, in average, 7 to 8 hours of sleep is absolutely fine. Someone might sleep for 8 hours, someone might sleep for 5 hours. So it depends. Individual variation is there, but only sleep is not only more sleep or less sleep is not a symptom of depression. You will have other symptoms also. How to overcome sleepiness, sleeping during day and waking up in night? Yes, that is a very important question that I like to take up. Over sleeping during daytime and waking up night is a very common problem that patients come to us. First of all, we need to know some very important structures in our brain. We have a very important small organ in our brain known as the pineal gland inside our brain that secretes a hormone known as melatonin. Okay, that hormone is responsible for our sleep. Okay, what happens nowadays with the increased use of screen may be anything. It might be TV, it might be laptop, it might be our mobile phone which we keeps on doing our Facebook, our WhatsApp, our Instagram. So what happen when those screen emits the light, our melatonin doesn't work properly and our sleep pattern goes for a toss. Okay, so the best way is to keep away from all the screen addiction. When you go to sleep, you keep away your mobile phone, your laptops. Always have a correct and appropriate sleep time, sleep routine every day. the there are certain sleep hygiene techniques which you can go through when you type in the Google search sleep hygiene techniques. That is very much important. Okay, like sleeping in the same time at going to bed in the same time every day, waking up at the same time. It might be different. It might be 12 o'clock for 12 midnight for someone, it might be 1 p.m. for someone, 1 a.m. for someone, or it might be 10 p.m. for someone. But stick to that appropriate time of getting up and sleeping. Okay, before you go to bed, we always need to freshen up ourselves. When we take a bath, we comb our hair, we apply some lotion, we apply some powder in our body. So when you go to sleep, you should sleep with a fresh body. Okay, then we always ask patients to avoid very hard drinks or like caffeine induced drinks after 7 p.m. if someone has sleep disturbances, because that keeps you waking and that keeps your wake cycle up. Okay, then another thing is that what we tell patients is your room should be full of air. It should be very dark when you go to sleep, because that will help the melatonin to induce sleep in you. Whatever I have told you about melatonin, it should be very airy. Even in the winter days, we suggest you take a blanket but put on your fan at least in 1 or 2 more, so that the air circulates. Then again, there are other variations that when you don't get sleep, do not toss over the bed and keep thinking and hovering over the phone or watch TV or read a book. Rather, you just do some deep breathing techniques that will relax your body. So these are some of the sleep hygiene techniques that you should be knowing yourself, and these are easily available in every site. If you type sleep hygiene, like our dental hygiene, we also have sleep hygiene which you should go through when you will and go through the list in the Google search. And most importantly, the smartphone, the TV, and the laptop should be away from your bedroom. That I suggest to every patient nowadays.
Sir, nowadays, as we are looking our laptop from 10 to 5 p.m.,
Hmm.
almost 6 hours.
Another
And
thing for good hygiene technique, I forgot. A good exercise is always necessary. If you can't do exercise in the morning, most I suggest patients to do exercise late in the evening, that so that it tires your body out, so that you have a good bath after your exercise, have a good dinner, and then automatically your body retires down for sleep. And most importantly, another thing I forgot, to avoid heavy dinner after 10 o'clock. That is what the people in Western countries follow, and that is very important and scientifically proven that if you have dinner at 9 or 8:30, which does not happen because of our Indian culture, that is very much appropriate for a good hygiene. Yes, some sir was telling something. Laptop.
Yeah, there was a query from morning 10 a.m. to 5 p.m. We are on this program basically and looking our laptop. So we can say almost 6 hours we are spending on that. And no doubt, I think this screen and interaction of this eyes creating some certain dilemma in brain somehow. Can we improve this
I did
thing
not get your second part. You are in this program till 6 o'clock. Then
from 10 to 5, almost 6 hour daily?
okay,
Okay,
okay. Then
the interaction of our eye, we are
infection,
interaction. We are direct,
interaction. Okay,
yeah,
yeah.
interaction of our eye with this screen. It is continuously going on.
Okay, correct.
So we feel sometimes some irritation.
Huh.
Can we overcome such type of things?
Sorry, sir. I will not be able to answer that because that is a part of the eye specialist. Uh, you are only using for 6 hours, but software professionals, IT professionals use it the whole day. Obviously, increased use of screen and laptop has increased eye problems, but that will be best answered by your ophthalmologist how to keep away the irritation from your eyes, because that is a common problem people have nowadays.
Hmm. Okay.
Someone was asking me to share the email ID. I have given my email ID, and I'll also share my phone number. People are asking. Sorry, sorry. Yasmin Ansari sir has asked whether I do online consultation. No, online. I do not do online consultation because ethically there are a lot of problems, because in psychiatry we are being controlled by the court and we have a different law of mental health act and mental health regulations. The very first consultation we cannot do over phone, but obviously if I have seen patients 2 to 3 times, I have known the patient, the patient has been using my medication over a year or so, then I obviously know how much he has improved or how much he needs to improve, or what are the problems, if any side effects are there. Then definitely I am available over phone to help the patient, but online consultation I do not do.
There are some questions in chat box regarding the sleeping problem. Can you sir please answer this?
Yappan, what is this the correct name? Sir, not being able to sleep in the daytime or even the night time. See, sleep is a huge issue actually. Just not being able to sleep in the daytime or night time, I will not be able to answer that problem. Okay, but at least to begin with, at least what I request patients, all patients, and I advise patients to do are the certain sleep hygiene techniques I have told right now. Okay, and sleeping in the daytime is very good. If you do not, if you are not, I mean to say, I told it wrongly. If you are not able to sleep in the day, it's very correct. You do not need to sleep in the day, but at night at least you should have 6 to 7 hours of daily sleep, or at least up to 8 hours of sleep, at proper sleep at night. To start with, you can begin, sir, with the sleep hygiene techniques I have told you. But even if you do not improve with the sleep hygiene techniques, there are 2 3 investigations that needs to be done on you. I am speaking now in a medical term, and you need to visit a health professional or a doctor who can help you out with various other issues that needs to be assessed if you are having problem with nighttime sleep. Dr. Rupa ma'am has asked what should be the period of deep sleep. I have already told ma'am that for an adult, average adult needs to sleep around 6 to 7 up to 8 hours of sleep in 24 hours. you can divide it. Obviously, if you sleep 1 hour at the daytime, if you have an evening afternoon siesta, then obviously you can sleep decrease your nighttime sleep for 1 hour depending upon the work you have. But average adult 7 hours of sleep is must for proper working of the brain.
Rashmita Mishra ma'am is asking, if someone spends more time in sleeping, is he or she under depression?
No, I have answered that question, sir.
Oh, yeah.
Yeah, if there are any other questions, or else we can. Yeah, is headache related to mental health? Being asked by Anita Brag. Yes, definitely headache is related to mental health. I have already told that headache is a physical complaint, right? So physical complaints are part of common mental health. If you have too much stress or if you work too much in a stressful situation, you'll have definitely going to have headache. That is known as tension headache. You have if you have very much anxiety, if you have depression, that might be a physical manifestation of your low mood, of your depressed effect. So headache is obviously it is not the golden rule that every mental illness will have a headache, but any unexplained headache, any obviously it has to be ruled out physically. Headache might be a part of brain tumor, headache might be a part of a stroke patient, headache might be a part of a patient who has had an head injury, headache might be a part of a patient who had an accident. But if all those symptoms are ruled out, patients are referred to psychiatrists to find out the cause of headache. Then we find out that stress is a part of headache. He is having headache because of excessive stress. Then we label it as tension headache or migrainous headache. Then if someone is having depression, he is crying too much, he has low mood, then definitely headache can be a part of mental illness.
There's another question coming in: depression, anxiety, and mood swing. What is the difference in these three?
Okay. Uh, See, mood swings will be there in anxiety and depression. Mood swings is that suddenly you are having a good state of mind and suddenly you become very aggressive, you become irritable. Like say you are working in your laptop, you are preparing for tomorrow's class, and suddenly your child comes and breaks a glass, and you will have mood swings. That is absolutely normal that your child is disturbing you. Okay, but you are working in your laptop, your child comes, he is having difficulty in his homework, and he asks, "Mom, please help me with that." Suddenly you throw his book and copy, and then suddenly you try to hit him. That is mood swing actually. That means you are irritated. That means you are working under stress. Okay, so that is mood swing. Suddenly one will have is behaving nicely, and suddenly he'll start crying for a trivial issue. He will throw a temper tantrum on a trivial issue. He will have sudden anger outbursts. That is mood swings. Mood swings is part of depression. Mood swings is part of stress. Mood swings is part of anxiety. But what is depression? In depression, you have classically low mood. You don't feel the need to work. You have low motivation. You feel very fatigued. You feel very weak. You don't feel the happiness in your life. You feel guilt. You feel hopeless. You have death wishes. Okay, you cry like anything without any reason. Okay, and then anxiety is something you are tense about. You are tense about anything. Might be, oh, I have to finish work course for this much of students. I have to correct check the copies of these students. What to do if I don't finish in time? What happens? My boss will shout at me. What will happen if I don't get the salary within the first week of my month? That is what anxiety is. That will keep you in extreme level of stress. That will create certain panic attacks in you. You will have difficulty in breathing. You will have tremors. You will have urgently to go to toilet. You will have sudden palpitations. when you have those stressors. So depression and anxiety are both different sets of mental illness, and we treat them both differently. But mood swings can be present in both the illnesses. Another
Any more
question is,
questions?
so these days breakup in relation and aftermath of the same entails depression and frustration and even suicide during teenage and early 20s. How can we handle that? Uh, this is a very important question. Breakup in relationship. Actually, we need to first and foremost we need to. I have written an article 3 to 4 weeks back in one of our local newspaper, Assam Tribune, that how to bring about emotional changes in your students' life, in your children's life. Basically, it was addressed to both the parents and teachers. There I have raised the issue of handling relationship in teenage years. Basically, in teenage years, you do not have the foresight, you do not have that much logical decision making capacities and judgmental abilities to find out your life partner, basically. Okay, so most of the relationship nowadays are in virtual world. They find someone attractive, they give a friend request in Facebook, they pin up the love symbol in the Instagram, and suddenly an infatuation starts. He might be of higher age than the girl or the boy. So all these type of virtual relationships are coming up because of increased screen addiction in children nowadays. So one needs to be, as parents and teachers, one needs to be aware of what the children or the student is viewing in his phone or in his laptop. That is number one. Second, we need to educate children about sex education, which is a must nowadays. Sex education is still a taboo because of our Indian culture, but sex educations need to be taught in schools right from the middle high school level, say from class 5 or 6. So in sex education, we can give up some topics of relationship issues. Okay, and then we need to teach children what love is, what relationship is, and what responsible relationship is, what adultery relationship is, what how relationship can differ in various stages of life. And I think with good education and clear communication between children and parents, or children and teachers, I think these issues can be handled. And again, one thing again to stress, of falling in love or having a relationship in the teenage years or in adolescence is absolutely normal. It's not a crime, basically. So again, as parents and as teachers, we need to regulate these issues to children. That is absolutely normal that you are being infatuated to someone, or you are being loved by someone, or you are in love with someone. But at the same time, some logical decision making capacities, some judgmental capacities should be imbibed in children as to how to go about the relationship.
So,
Mrs.
but
Lipika, yeah.
but so sometimes it happens that that was my question actually. But
Ah,
sometimes it happens that teenagers or maybe in early 20s, 22, 23 years time, so they
hmm.
become very stubborn. Become very stubborn, wanted
They
that.
become
Yeah, they don't
they
listen. They
become
don't
what?
want to shift their focus and all. They don't want to talk
I'm not.
to.
Your voice is breaking. They become.
Okay, my voice is breaking, so. So, I
Yeah.
wanted to know, that was my question actually. This is all
Uh,
that you told. It gave me a good light on the on my question. But
uh,
one problem is that sometimes children become very stubborn on this. They
okay.
don't want to get rid
Yeah.
of that.
Correct.
They're not
See.
ready to discuss. Yes,
Yeah.
sir.
But they. Yeah. They become stubborn. They become.
Yeah.
They become. They think that their decisions are the correct decisions. Right. That is
Mhm.
actually a classical feature of what adolescent is. They are regional state of identity. Right. They are still not adult. They are still not children. They are in their middle phase. Okay,
Yeah, yeah.
at times you have to respect that what I can, if I want to say, that unresolved identity crisis in adolescent, that you have to respect that situation in an adolescent or your children, whomever you are asking the question about. and that handle the situation in a friendly way, not in a authoritarian way, not in a Hitlerian method, not in a helicopter way. Okay, तो ये क्यों कर रहे हो, ऐसा नहीं होना चाहिए, ये गलत है, ये वो है. Give them the right perspectives, show them the right perspectives, show them the wrong perspective also. Okay, that you're having this relationship, it might not work out because of this issues. Obviously, if you're having this relationship, these are the positives you can have out of this relationship, but negatives are more out of this relationship. So think carefully, show them and guide them. And what I suggest to parents is, you cannot be a Hitler or a helicopter type of parenting into your students or children. It might be in a balanced, friendly way. Okay, and as parents and as teachers, there are certain limitations also. If they are being extremely stubborn, and if they are being extremely disobeying you, then you need to seek professional help. Okay, because at times, as parents and teachers, there are limitations up till a time you can help also. And but still we give them the insight, as parents and teachers have clear communication with them. That is why the root should not start in the adolescent, it should start at the toddler phase only. Okay, it should start from the early class 3, class 4, class 2, class first standard only. You should have that friendly relationship with your children, friendly relationship with your students. Give them the option of taking responsibilities, connect with them, ask them the opinion about what they can give opinion regarding any household responsibilities. Any, like, you can ask them, आप क्या सब्जी बनाएंगे रात को, you give your opinion, come and help me in the kitchen. That some family is having a problem, ask them about the opinion of to how to handle their problem. Don't treat them as a child right from the childhood. Treat them as an adult, as in friend, right from the stages of class first or class second. Then the relationship becomes totally different, and then you will find that your students or your children are in a totally different way of mode of communication with you. Obviously, you have some control of them, but that control should be in a more friendlier way, in a more communicative way, rather than being more punitive and being more Hitlerian type.
Thank you, sir.
Lipika Aidya ma'am has asked, what is bipolar disorder? Ma'am, bipolar disorder does not come for the discussion today, because we are discussing about common mental disorders like stress, depression, and anxiety. But bipolar depression is a serious mental issue, serious mental health disorder. Bipolar disorder means, if you split the word bipolar, it means bipole, means two directional. Bi means two, pole means if you take a straight
Opposite.
line and if you draw, yeah, opposite pole. Yeah, in one pole you will have severe depression, the patient will become low, he will cry, he will have suicidal ideas. Okay, and on the after some days he improves, and suddenly he becomes in a manic phase. He is very happy, he is cheerful, he'll spend excessively. Okay, he will buy unnecessary things, he will have high risk taking activities. High risk taking activities means having excessive sexual activities, going out with prostitutes, riding a bike with one hand. All this comes because of genetical issues, because of various brain circuit abnormalities. Also, and trauma to the brain can cause this disorder, and most importantly, in adolescents or in young males, we find because of drug abuse. Drug like cannabis, heroin can lead to bipolar disorder.
Mike, my another point is the mood swing can be identified as a bipolar disorder?
That is a symptom of bipolar disorder. Absolutely correct. That is not a symptom, but it is a trait of bipolar disorder. People who has bipolar disorder, or people who we diagnose as having bipolar disorder, when you take history from the patient's family members or the patient relatives, then we find that mood swings were a part of his life.
Now, how to handle them? Like a person who is very angry in the morning, then he is fine in the evening.
You need to treat that. That will come up with medications, ma'am. You cannot handle that
not
with
by
any
counseling.
counseling. No, counseling won't help a patient with bipolar disorder. Serious mental disorders do not improve with any counseling, any clinical psychologist. Those needs to be treated with medicines.
But these extreme
Yeah,
mood swings also.
obviously, ma'am. But there are issues when mood swings might not be a part of bipolar disorder. Also, at that time, we give counseling sessions on or psychotherapy sessions on anger management, how to handle your anger, how to remain calm in any situation, how to decrease your anger, how not to have anger outbursts. That all comes in psychotherapy sessions of anger management. That will bring down a lot of mood swings. Yeah, hello. Hello.
Yes, Dr. Anweshak.
Yeah, there are two more questions. I think I'll take these two questions, and it's almost five. Then we can wrap the session up.
Yes, sir.
Is it healthy to be introvert? Being asked by Rashida Madani, ma'am, I guess. Yeah, you cannot tell introvert is being having an introvert characteristic is a bad characteristic or abnormal characteristic. Obviously, it falls in the domain of one of the personality traits. There are introvert people. There are people who are extrovert. There are people who are overtly cheerful any time of the day. They which we call bindas people. They don't have any pressure of life, no stressors in life. Those are characteristics and personality traits. Yes, it is healthy to be introvert, but if we asked if this question would have been asked to me by one of the professors in my exam, then I would have answered it in a different way, because every personality character are vulnerable to every other mental illness. Say for people who are introvert are more vulnerable to anxiety and depression. People who are very extrovert and who are always jovial are vulnerable to bipolar disorder. So that is another way of answering the question, but don't worry about that. It is healthy to be introvert. And Manoj Kumar has asked how to overcome with the pressure of helplessness. Yeah, helplessness, you can obviously come out with whatever I told. That was a part of the WHO slogan. Let's talk, come out, communicate, seek help, ventilate your feelings to your near and dear ones. It might, at times, many of us are not being comfortable with our family members. Then you can confide on a very close friend of yours or your very close colleagues. But at least do not internalize your problems. Go out and speak and seek help. And obviously, we mental health professionals are there all over India, wherever you are, maybe. And at least ventilation and expressing your feelings, expressing your emotion helps a lot. Uh, Shabani Das has asked people like people's animals also have stress. Yeah, I get that will be that can be easily answered by a veterinary doctor, I guess. But yes, I have been having a pet dog since the last 10 years. Yes, they do have stress. They do have anxiety. They have separation anxiety. When I leave my dog early in the morning to the clinic, he barks at times. When I come back, he hugs me. So yes, there are stressors in animals too, I guess. But more appropriate answer, I think I'm not quite experienced in animal psychology yet. How to correlate emotional feelings with professionalism? I did not understand that question by Changdev Mani. Emotional feelings with professionalism. If sir can come in line, he can explain it to me. I'll take the other question. Is it possible that mentally disturbed people have dual personality? See, Yasmin Ansari ma'am, that dual personality is a very lay term that is being used by the common people. We psychiatrists do not label the term dual personality. Dual personality is used in persons who have schizophrenia, In those patients, those schizophrenic patients are another set of serious mental health illness, which is again totally out of the topic which we are discussing today. Schizophrenic people have auditory hallucination. They hear unnecessary voices. They suspect other people. They believe that others are conspiring against them. Voices will command them. Voices will abuse them. So they are in a different world altogether. So those person will have a different set of emotions and interaction when we speak with them, and then you will find that they are interacting with their voices in a totally different world. So that is why in common language we not we in common language people refer to them as dual personality. So it comes, those mentally disturbed people have schizophrenia, and we do not use the word dual personality. Mini Tom has asked, is jealousy a mental disorder? It is not a mental disorder, but if you are jealous, that is a part of your personality trait. Again, that at times being jealous is good. That will help you to be competitive enough. But again, if you are being too jealous, you will come into the spectrum of severe mental disorder. And I don't want to speak of those illnesses today. Yeah. Are there any questions, Aradhana, or we can wrap up? It's almost five.
I think no more questions are coming up. I think we can wrap up. Would you like to say anything from your end?
Thank you all. Thank you for attending and hearing out my presentation, asking queries. I hope it was, if not at all helpful, it was a bit helpful, and you have gained something out of what I have presented, so that you can at least spread the awareness of mental health issues in the society. Mostly break the stigma levels in our society. Be aware on and be at least keep your eyes and ears open to whatever mental health problems with those internalizing and externalizing symptoms I have told, for anyone near and dear ones near you, so that you can help them out, because mere helping you out and mere speaking can prevent a suicide and help someone to carry forward with their life. And thank you for the patient hearing, and thank you Aradhana Mishra again for involving me in this session. And that's it. Thank you.
No, one more question is there. Somebody has posted a question.
Okay.
If you could answer this, I think it's very relevant in today's life. Is jealousy a mental disorder, by Mini Tom?
Yeah, I have already answered this question.
Oh, then I must have.
Pam, it's not a part of mental disorder. Jealousy is a part of a personality trait. Okay, but being a bit jealous in a student's life can be helpful to be competitive in their career. But excessive jealousy, turning into conspiring act, turning into aggressive behavior, is a part of mental illness.
That can be handled?
Yes, obviously that can be handled.
Thank you, Deepika. Okay. We would like to convey our gratitude and thanks to Dr. Anweshak for giving us such a valuable time this evening to conduct the session and impart his valuable knowledge. And we, as participants, have gained a lot of knowledge, have learned about what are the symptoms of stress, and obviously how to manage them. And we will try our best with the knowledge gained to implement on others, and also to try to help other people in the society or maybe around us if they can find symptoms of stress in them, to detect them and help them clinically to approach a doctor. So this session, I think, was a very helpful one for all the participants. Many of us have even cleared the doubts or questions, and speaker today has been with us so patiently answering